Thank you. Debo Ronald is my name, the Executive Director for Healing Hands Foundation. Healing Hands Foundation started as Rema Foundation. We have been doing these community services, though on a small scale. And when we wanted to register, we found Rema Foundation name was already taken. So we rebranded it as Healing Hands Foundation. So this organization has been formed like 2 years ago. Our main aim is just to serve our people, help the community in socioeconomic issues, and health is just one of them. So this health camp, we conceived the idea some time back. We've been working towards it, and we're trying to make it routine, because from the way you see, the demand is a lot. There are many young girls who have not been immunized against human papilloma virus. This is a virus which causes cancer of the cervix. So you're supposed to get that vaccine before you start having sex. So many of these children, I was surprised, they are not vaccinated. Yet the services are available in the hospital. It is either the lack of information or the lack of will to reach the hospital. Now, that alone justifies these outreaches. If people cannot go to the hospital, then you can reach them with the preventive services. And in the long run, the effect will be felt after some time. So you see in this city, there's a lot of death, premature death. You hear every morning, this one has died, this one has died. And when if you go deeper in the causes of the death, they can actually be prevented. So right now I'm told the number has exceeded 1,400. I don't know how the day will end, but it simply shows that we have not exhausted this opportunity. And many other people elsewhere have been asking for the same. We're discussing already. We're going to make it routine. After every 3 months, there will be an outreach somewhere. After every 3 months, there will be an outreach until we exhaust the desperate need of the people. Of course, as we do that, we also come up with appropriate referrals to the main hospital, to Oli Health Center 3, to police, to even to Kampala. Even some of them, people are taking care of them, like the autoimmune diseases. They are going to look for funds to treat those clients, because managing an autoimmune disease is very expensive. So all in all, the benefits of this health camp are enormous. And we're not only doing that. I told you, Healing Hands is about the socioeconomic transformation of the people. The next phase is going to be skilling. We're going to skill the youth and single mothers on various skills. That one I will tell you more when the time comes. So indeed, this thing shows that the demand for health services is still enormous, despite the available services. That means the referral hospital or the government facilities around should start embracing outreach as one of their key activities. Because if you remain in the hospital, some people remain in the community, we will only receive them when they are critically sick. So I am happy with what they have done today.
And there are still a hand of people who have not accessed this service from Friday to today.
Yeah.
Now that you said you're talking terms, do you think you will be able to access those who are unable to come to such areas? Maybe they are crippled or they are sick at home.
Hey, actually, I was surprised. Some people we had to give them boda to come. They are either old or they are disabled physically, others mentally. So you have to get ways of getting them here. Others have sent a team to see them at home. So there's need to reach out to the people. There's even now need for mobile clinics. We should go beyond. Actually, in the community there, if somebody is critically sick, whether it is a palliative case or due to disability, nobody is supposed to die a painful death. So it is advisable using the VST system. If there's somebody critically ill at home, they should bring it to the attention of the health workers. Maybe you send a team of a doctor and a nurse to go to those homes, help this one person. They're not very many, but they are there. We could reach them one by one, so that all of us should have the benefit of enjoying good life. Yeah.
Okay, as we close this day, Have you been so impressed about the turnout?
I'm so impressed. I'm so impressed. I'm also humbled. Impressed because people were able to respond to our call. It means our diagnosis of the community problem was correct. We have diagnosed some issues in the community. We're trying to find out, are they true? Now this health camp has proved that there's demand for outreach services. I am humbled because government has done a lot of work. Now, NGOs should come up, team with the government to fill the gap. Uganda government is trying its best. There's a tremendous improvement in the services of the referral hospital and even Oli. But government will never do everything. So let every organization, every person, individual, or a group, let's come and supplement government efforts. Yes, let's come and supplement government efforts so that at the end of the day, we share one another's burden. Yeah. It should not be to do with the politics. It's about the people. Yeah, it's about the people.
Okay,
Yeah.
lastly, a healthy community, is a healthy economic source for the government.
Exactly.
How can we ensure our people remain healthy, but also economically viable?
Yeah. You see, they say health is wealth. At the same time, prevention is better than cure. It is cheaper to prevent diseases or conditions than treating them. Treating them is very expensive. You see, this vehicle which passed here, the vaccines we brought here were exhausted. So we went back to Oli. That vehicle has brought more vaccines to prevent diseases. Once you prevent disease, the population will be healthy. Now you see, polio has almost been eradicated in Uganda. That means even malaria can be eradicated. Cervical cancer can be eradicated. Cancer of the throat has been a common case because people are smoking, people are drinking alcohol, they erode the mucous membrane of the esophagus. So that with health education can be prevented. And many, many other conditions, even hypertension, if it is well controlled, somebody will have a good life. Diabetes, you find people are here with the sugar level in 30s. What is this? Blood pressure, somebody is staying with a blood pressure of 204 out of 113. You wonder where this would have been. You find they will only manifest with what? Stroke. So people need to be educated about their health. So at the end of the day, we are all alert about our health conditions and we live a good life.
Asma gina dana Zainab Yahya Kamis wen ana fifi selta Muru ana fifi village ta Pangisa ward. Kalamu alinare jimne na dawa de na furahi zaidi kalamu ede min fi maisha tena lise na inuma. Nare na furahi zaidi nasma dawa giwe di fuli na jere fogo na ligoma. Lakini besi na gura kala weri nena jakan dawa gura jafi sel tena fi Muru sel. Ma apa bibia Pangisa na school alja ini nare na furahi zaidi kalamta ligo dawa na ligo yom kulne giligo tabu tagora fi daktari dawa ma tabi dor fote dawa ma lakini nare na ligo dawa ma seme bila wasiwasi ana furahi na zola aljib na organization wetu ayana aljiba na inde namna lana ons fi daktari mara milani gira sulana robio dawa na giligo dawa to ma lakini nare ana wonsu ana ligo dawa to mara wai sawa de derana dawa tai ana gura burushala fa yana ligo fugana ana taigi kelem na kwana tena ablisa jafi dawa de makede ja dawa de fi wala dinare sai dashar dawa de fi u badashar talata kila badashar talata dawa de fi kanas makalam raba na jimne na jere fi area tena kena kafu makena gija fogo anasta bara milana aljafi dawa de lakini ina ta area na kisilan ana gina dito kumkulke to kumjafi dawa de baawo nina inshallah namna ana gain kelengal kalamade gi koma nare lakini anas milan lisa kana mama ben nana jelisa anas wadin basma nare masaba kan munzidi nena fogo yom wa inshallah kan fiseme kalam nare ari kalam de bidor na kila zola na jafi daktara na logo jede ya kana na jikede zido nena marawa inshallah.
By name I'm called Surambaya Badru. I came from Academy Cell, Awindri Ward Central Division. I'm one of the mobilizer for this medical camp. I've really mobilized communities. Most of them, they come, they've got the medicine. Also, they have thanked me. of it. And the benefit of this medicine, it helps the community so much. It has really helped the community so much. The one who have got, they thank us because we have mobile. They didn't know about it. And what I'm saying, let it not remain today. Eh? After 3 months, let it come, because we really need of it. Eh? Most of the people here in the central whatever division, they don't have what? They don't have money. So this free medicine, it's okay. Eh? Next time, let them bring it so that they help them.